enjoy the opportunity to catch up with Dr. Pat Shannon because we talk about any number of different topics. And he is on the line with us here this morning, of course, with IRMC for how many years, Dr. Shannon, have you been at IRMC?
Been with IRMC since, I believe, 2006.
Wow, you're a veteran. Our conversation this morning brought to you by Marcus and Mack, a law firm representing injured people. I talked about this earlier this morning. The football teams and the other sports teams for our high schools are having what's known as Heat Week or Heat Acclimation Week as they get set for the opening of training camp next week. With as hot as it's been at some points during this summer, that's a pretty important thing, isn't it, to get yourself acclimated when you're going to be that active outside?
Yeah, absolutely. Heat Week, back when I was in high school in the early 90s, you just pretty much showed up to two-a-day football practices and went at it. But there's been a lot of research done in regards to heat-related illnesses, and the Heat Week that the local football teams are performing is absolutely essential. We now know that it takes between about 7 and 14 days for a student-athlete to really become acclimated to the heat. And we've seen by implementing a Heat Week, we've seen a lot less heat-related illnesses and deaths with that process in place now.
Those first few games of the football season are played basically in summer heat, and there are a lot of teams that are plagued by cramps, muscle cramps, that a guy will be running in the middle of a 60-yard run, flying free, and all of a sudden, boom, he's down because his calf cramped up. That's a pretty common thing when you get early in the season, and you say, well, he didn't drink enough before the game. Hydration's a little bit more than just about that, isn't it?
Yeah, it's about electrolyte replacement as well, and a lot of people tend to believe that the muscle cramps associated with heat-related illness is potassium. You'd hear often, you got to eat a couple bananas. But actually the most common electrolyte abnormality in someone with an exertional-type heat problem is actually sodium loss, because as you sweat, you lose more sodium. So rather than drinking a lot of free water that lacks any sodium, the athletes kind of lean on the sport drinks like Gatorade and some of these other electrolyte replacement products that are out there. And that kind of curbs some of that. But once again, it kind of goes back to your Heat Week and your heat acclimatization process as well. But hydration is absolutely key, especially in the month of August. Approximately 2/3 of all the heat-related episodes and emergencies that we'll experience in the emergency department and on the athletic field are going to occur in that month of August. Mm-hmm. And hydration is key, along with good electrolyte replacement.
And we're talking about this in the context of high school athletes getting out there and college athletes. But really, when you're talking about heat issues, heat exhaustion, heat stroke, whatever the terms that you're using, it applies to people of all ages and anybody that might get involved in some sort of physical exertion.
Yeah, absolutely. Heat. We typically think of a classic when you talk about heat stroke. Heat stroke's a serious medical emergency. Generally, that's body temperature greater than 100.4 associated with some type of neurologic problem. And generally, that involves an environmental exposure to heat and the ability to kind of not escape that hot environment. And then your exertional heat stroke is generally a younger, otherwise healthy individual engaging in like a heavy exercise in periods of high humidity and high temperature. But this can certainly happen to anyone. This can happen to anybody from an infant, and smaller children are very prone to sensitivities in heat. And then the elderly and those individuals with medical problems, cardiac issues, breathing issues as far as pulmonary, and even the types of medications that people take can affect their way that how long they can operate in heat.
Yeah. I don't know how roofers work in the summertime, but somehow they get the job done out there, and a part of it has to be because they're so acclimated to it. But they have to protect themselves, highway workers, everybody like that. And at some point, they're going to end up. Somebody is in the ER or maybe even going to Urgicare, or now there's a walk-in clinic at IRMC, and seeking treatment. IRMC is really sort of expanding the opportunities for folks to get themselves treated for what we might term minor. At the moment, it doesn't seem minor to you when you've got those issues going on, does it?
No, it doesn't. And I would encourage anybody that has been out in the heat, that might be feeling dizzy, nauseated, fatigued. You really should have that. One, remove yourself from the heat immediately. And if you're still not feeling well, I would definitely recommend checking out one of those sites. We now have the walk-in primary care clinic in front of the emergency department for kind of like your milder complaints. We also have the Urgicare in Blairsville. It's been there for years. And then, of course, if you really feel absolutely terrible and something just doesn't feel exactly right, the emergency department at IRMC is fantastic at dealing with heat-related emergencies. I know they've already had to deal with a couple. So the bottom line is, if you're not feeling well and you've been out in the heat, one, get out of the heat, and then two, get checked out.
Absolutely. So IRMC Urgicare at Chestnut Ridge, IRMC at Chestnut Ridge, you're dealing with all kinds of different things there. It might be that sprained ankle that needs an x-ray. It might be heat issues that we're talking about. It might be something like poison ivy, things like that.
Right.
That's what Urgicare is all about, right?
Absolutely. We tend to see a vast array of complaints. This time of year, we absolutely do see some heat-related illnesses, poison ivy, small lacerations, sprains, strains. And the nice thing about coming there is we're hooked into the IRMC family. So especially our student athletes, we want to get them back on the field as quick as possible. We have a great working relationship with the Center for Orthopedics and Sports Medicine. And a lot of times what we'll do is we'll get the workup started for that injured athlete. And most of the times, prior to them leaving the urgent care or the walk-in clinic, they'll already have an appointment with one of our orthopedic specialists.
Mm-hmm.
And that holds true also for just our weekend warriors and our elderly population. Anyone we see, we definitely try to do go the extra mile and make sure that they have some great follow-up.
Yeah, klutzes like me. That's another way to put it. The kind of people that don't know how to step down off a curb is the way I always put it. But yeah, I
actually specialize in those.
Oh yeah. So you probably would not be surprised to see someone like me walking in. But there's a difference between Urgicare and the walk-in clinic, isn't there?
Yeah, so we launched the walk-in clinic a few months ago, and basically what the interesting portion or the selling point for the walk-in clinic is you can actually be evaluated as a walk-in for a minor injury or illness, and then our nurse practitioners that we have there, if you don't have a primary care physician, you can actually be plugged in and use one of those as your primary care provider. So it's a unique situation. Generally at urgent care, we will see you, and then you will follow back up with your primary care doc, or we will refer you to a primary care doc that's accepting patients. But the walk-in clinic, if you liked your care there, sure, you can continue to follow up. We have Amy Constable there, and Maria Stiles is just doing a fantastic job for us. And they work closely with the physicians for the Indiana Physician Group. And so it's really kind of given us an avenue, offering an avenue of care that we just haven't been able to do in the past.
Yeah, and one of the things about that is it is a walk-in clinic. You don't necessarily got to make yourself an appointment.
That is correct. And, we just launched, and our hours right now are 8 in the morning till about 5 in the afternoon. And those hours are likely going to be augmented to even some weekend hours as that clinic grows.
Yeah, that's a great thing to have. So you've got the walk-in clinic, you've got Urgicare, and the docs there at IRMC are doing whatever they can to help you with whatever your medical crisis might be, whether it is a crisis or not. And ER is a big part of all of that. Dr. Pat Shannon with us here this morning. Has it been a busy summer for you?
It really has. It has been a busy summer. I think that with the the control that we're getting of the pandemic right now, more people are out and they're doing their vacations. They're out and about more often, and we've had a pretty busy summer with everything from sprains and strains to lacerations and you name it. So it's been hopping.
Yeah, I bet you it has. So speaking of COVID and what we're reading about being escalations in the numbers as the next new variant comes along, and there will be more variants that come along after this. What should people be thinking right now about COVID and protecting themselves and others?
Well, at this point, if you're having symptoms that are consistent with COVID, I would highly recommend that you get a test, because we have medications now available to us that we didn't have a year or 2 years ago. So that significantly changed the way that we approach COVID. And we have some medications you can take by mouth in your own home. But the key factor is you have to be diagnosed within 5 days, and those medications have to be started within 5 days. So as far as protecting yourself, there's still recommendation that if you're indoors and you're exposed to a lot of people, you may wear a mask. But the biggest thing that I can tell people right now is don't assume that it's allergies. Don't assume that it's your usual sinus infection. Get a test, because if you do test positive, we have tools now that can help you get through this a lot quicker with a decrease in your morbidity and mortality.
It's terrific news. Terrific as they continue to battle this, and I know that's a lot of pressure on folks in your line of work to make sure that everybody is being kept as safe as is possible. Well, he's Dr. Pat Shannon, spending some time with us. It's always good to hear from you because you have so many different things that I can ask you about. So our lessons today are stay hydrated, watch for signs of heat stroke, and you've got great resources like Urgicare, the WalkIn Clinic, and the ER.
Yeah. Hey, thanks, Todd. Always appreciate you having me on.
I appreciate you coming along. Have a great day today.
You too, Todd. We'll see you.
Bye now. There's Dr. Pat Shannon with us here this morning. It's the voice of Indiana County, WCCS 101.1 FM and AM 1160.